We're here to promote cnsupdates.com, which is a website for medical professionals interested in neurology. Our latest masterclasses focuses on narcolepsy and restless leg syndrome. The courses are being presented as a virtual masterclass featuring leading specialists from around the world.
My name's Donna Willcock, and I'm an assistant professor at the University of Kentucky in Lexington. The title of my talk is Using Neuroinflammatory Phenotypes to Personalize our Treatment Approach to Alzheimer's Disease. And so what my work focuses on is not just looking at whether a patient has inflammation or not, but rather what type of inflammation they have. So there's multiple different types of inflammation that can happen in the brain. And so we took autopsy tissue from patients who were defined as having early stage Alzheimer's disease. And we measured a lot of genes that help us identify what type of inflammation is happening in their brain. What we found was that within that population of early stage Alzheimer's disease, some people have one type of inflammation and some people have another type of inflammation. And so what we're trying to do is identify markers in the serum that help us predict what the type of inflammation is in the brain so that we can better target treatments based on what the inflammation is doing in individual patients. The main conclusions were that inflammation in the brain was once thought to be very basic, and that the brain wasn't capable of the types of responses that we see in the rest of the body. It was considered that the brain was somewhat immune privileged, which in some ways it is. It has a blood-brain barrier, but the cells of the brain, the microglial cells, which are the immune cells in the brain, they are capable of a full range of immune responses if they see the right stimulus. And so in the 14 years I've been looking at inflammation in Alzheimer's disease, this whole idea has evolved. From when I started, the idea was inflammation is bad, and there's one type of inflammation in the brain, and that's just an activation. To now we're looking at different types of inflammation and hopefully harnessing some of those good responses to help ameliorate the pathology in the brain of Alzheimer's patients and get a good clinical outcome. So the Staying Sharp program is a really interesting program that is operated by the Donna Alliance. And it was in association with the AARP, which is the American Association for Retired People. And so it's a free, open forum for anybody to come to, but it's promoted more for the aging population to come and hear about how they can keep their minds active, how they can potentially prevent Alzheimer's disease by staying sharp. So we had a couple of basic scientists. There was myself and Linda Van Eldik, who is the director of our center in the university. And then we had two clinicians who see patients. And so it was a discussion about how to stay active with your brain, and then it was a question-answer session for the people to ask anything they wanted about Alzheimer's disease, about what we know, what we don't know, So it's a really good forum, and it's offered free to the community. So. There's been a lot. I think the growing, for me personally, the growing recognition of inflammation in a lot of different sessions. So, while we only had the one targeted inflammation session, you kind of see inflammation coming into a lot of people's talks now. There's been some really interesting ideas about new therapeutic approaches for Alzheimer's disease. And I don't attend so much the Parkinson's side of things, but the Alzheimer's, I think we're going to hit something soon. How soon, I don't know, but there's a lot of people pushing on it, and I think we're coming to a consensus now, a little more, about what our target should be and when we should start treatment, which is early. That's the consensus, the earlier the better. So, if we do the right trials with the right drugs, it's not going to take too much longer to see some treatment.